Hi, welcome to our clinic, and this is our reception area. First, when you want to walk in, you want to make sure that there's nothing like as a trip hazard, like the carpet's flat, there's nothing like lifted up on the carpet.
Right. And you also want to make sure all of your patients are properly restrained. So dogs should be on leashes and cats should be in their own carrier, and they shouldn't be able to just free roam. Also, when you admit your patients into your clinic, you want to make sure that all of the warning signs about aggression should be noted, and there should be no dogs around any dog aggressive dogs.
Okay, so we're in the exam room, and when you enter the exam room, we all have a computer in our exam room to access patient files, but you want to make sure that there's always a password on there so people can't gain access to the patient's files that aren't allowed access, like patients coming in so they can't just go in and look at stuff. And then you want to make sure that every exam room has a sharps container so we can dispose of our needles properly. And
every exam room has a mat on the table to prevent any slippage or animals falling off. We also have PPE regarding handling an animal. So these lead gloves are great for working with cats who are particularly stressed or aggressive. There is also muzzles for aggressive dogs, and we also have muzzles for cats to prevent any bites. And this cat bag is very resourceful for cat exams as well, because it kind of hugs them and releases endorphins to make them less stressed.
And then you want to make sure that you have some type of spray. We use Rescue to disinfect the room after every patient to make sure we're not spreading like different diseases or pathogens to different patients.
So in our surgery area, you can try to find a safety data sheet, also known as SDS. Now this is what has all the safety precautions in case anything does happen. It has information on drugs, and it has information on anything that can be in the surgical area.
So over here we have our controlled substances. And with controlled substances, you want to make sure that they're locked in a cabinet. And then we have drug sheets for each of our drugs. So this one's buprenorphine. And you want to make sure you write the date, the patient's being used on, the client address or the address of the clinic, the bottle number, and then how much of it you're using, and then just your initials so we can keep track of how much of the substance is being used and making sure none of it's just like mysteriously going missing.
So when a patient is in surgery, we always want to make sure that our crash cart is accessible. In case you don't have the emergency drug sheet on the other side of your patient anesthesia sheet, we have a list of the emergency drugs and doses, just in case it's not calculated. And it should be bright red, accessible, and inside of it there are intubation tubes, emergency drugs such as atropine and epinephrine. We also want to make sure that it's close to our surgery suite in case an animal goes into any cardiac arrest or respiratory distress.
So this is our anesthesia machine. You want to make sure you do your check off on your anesthesia machine, make sure there's no leaks for the patient and for you so you're not inhaling the ISO. And if there is, if you spill ISO, you want to make sure you follow the protocols to cleaning that up because it can be hazardous. And yeah.
So this is our O2 room. These tanks are very pressurized, so you want to make sure that they are upright and chained to the wall, okay? And we want to make sure that we have these caps on it for protection, as well as making sure that they are completely turned off when they are not in use, for example, for surgeries. And when you're transporting them, you want to make sure you use this dolly to make sure that you don't drop it yourself, and it also allows you to push it around in an easier fashion.
So this is our laboratory, and here in our laboratory, this is where we do our raw clinical stuff with blood and urine and bacteria. So you want to make sure that you have the proper PPE, especially with gloves, goggles if it's needed, and you want to make sure that you are properly covering yourself in case there's anything that could be contagious or anything that can get on your hands. So also in of laboratory, you want to make sure that you have a broken glass container to throw out any broken glass so you don't cut yourself. And make sure you always wipe down anything that you use to make sure nothing stays on the tests.
Alright, so now we are in our radiography unit. We have all sorts of PPE in here. So these are our lead aprons, and we also have thyroid shields and our lead gloves as well. We want to make sure that they're stored properly, and these prevent any radiation, any scattered radiation from coming in contact with them. These leg ties are for the safety of your patient to restrain them.
And then when you're taking the x-ray, you want to make sure that you don't have any of your body parts in the primary beam, because you can still get exposure even with the PPE with the primary beam. And then you want to make sure that you have signs up that say that radiation is in use in this room, and you want to make sure the door is closed when you're taking x-rays.